Our research into adult congenital heart disease related heart failure really goes from the bench to the bedside to the population. So at the population level, we're using these very powerful national big data sets to understand population trends in heart failure affecting adult congenital heart disease patients. And that's important because it helps us to anticipate the future care needs of the population of patients that we see. It also feeds into advocacy work at the local, at the state and at the federal level. At the patient level, we've been looking at our experience of adults with congenital heart disease and heart failure, and already we've been able to identify who's at risk of developing heart failure. And that's critical information because it can help us to identify those at-risk patients earlier, and we can also provide information now on what kinds of survival and outcomes are expected for people who have a new diagnosis of adult congenital heart disease and heart failure. So that's providing certainty to patients and families around what might the future hold. And then at the benchtop level, we are involved in some of the more experimental studies that are trying to understand the mechanisms of heart failure and therefore future therapeutic targets for heart failure in adult congenital heart disease.